Welcome to Helping Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show was designed to help women become champions of their own health care. Tonight we're going to take on the topic of back to school. As summer draws to a close, many parents are facing the first time sending their kids to school, and some are facing sending their kids to different schools. This can be a time of challenge both for the student as well as the parents involved. To help me better understand these issues, I've invited Dr. Brent Rosser, Pediatrician at the Murfreesboro Medical Clinic, to help us with some of these issues and provide some advice to make them a little bit easier transitions. So Brent, I want to start off by saying thanks for being willing to be here. Now, I want to start off with kind of where it all begins, which is the whole idea of kindergarten. And, you know, I know a lot of parents are sending their kids to preschool and this kind of stuff, but not everybody. So a lot of parents are facing that first time trauma of sending their kids to school. How do you deal with that in your practice?
Well, it's difficult, and especially because children develop at different stages. Some children at 5 are ready to go to kindergarten. Some aren't ready till closer to 6. So I encourage parents, if they can, to put their child in preschool, maybe for a year or so, or in a pre-kindergarten, if they're not sure if they're ready for kindergarten, just for them to be in that classroom setting with other children where they have to sit still and do some work and listen to a teacher, and that way they get a better feel for if their child is ready to go or not.
And this is a time of real intimidation for a lot of parents, isn't it?
It's difficult, and it's like you said, it's kind of the first step of their child growing up and them being out of the house on their own a little bit, where they have to make some decisions and do some things on their own. It's difficult for first-time parents to go through that sometimes.
Well, now, the next thing I want to talk about is that there are requirements for kids to get into kindergarten. So it's not just the whole issue of transitioning. Now we've got to figure out there's some medical requirements. What are those medical requirements for kids to enter into preschool, or excuse me, kindergarten?
Well, first of all, they have to have a kindergarten checkup, and it needs to be the same calendar year that they're starting kindergarten.
Okay.
So even if they turn 5 the previous year, their checkup needs to be the same year that they're starting kindergarten that fall.
Interesting. Okay.
And there are also immunizations that they need to be caught up on. There are generally 4 immunizations that they need between the time that they're infants and the time in kindergarten that they have to be at least 4 or 5 to get. Okay. And so when they come in for that checkup and we go through their immunization record, we give them a form that the state of Tennessee gives us that has all their shots and the date of their checkup, and I sign those places, and that's what they give them at school to be registered.
And they have to take that with them, I know, because we had to at kindergarten. That's something you have to do. And the physician, you have to actually go see a physician to be able to do this?
That's correct, yeah. They get it from the doctor's office. It's not something they can get online and fill out themselves. It has to have the signature from their doctor that they're up to date on their shots, that they've had a kindergarten checkup.
And very important, this is a checkup. So they're going to get other things, not just vaccinations. A lot of parents don't understand this. They should get a complete checkup, not just, you know, the vaccination type stuff. Is that right?
Absolutely. It involves a physical exam, and we sit down and talk about how things are going health-wise, but also socially and developmentally. Because some things may come up that they hadn't thought of that we may need to discuss before they start kindergarten, whether or not they're ready socially. Most children are ready physically, but there are a lot of other factors that impact that.
That's great. Now, one of the things you mentioned is vaccines. Now, not every parent decides to vaccinate their children. What about a parent who says, I didn't vaccinate my children? What do they need to do in order to be able to get their kids into kindergarten?
Well, there is a place in that form that a physician can check, saying that they that the parent understands the risks of not getting those vaccines, and that it can be checked by the physician and signed. Not all physicians will do that. Now, usually it's stated a religious exemption, and it's not always a religious exemption. Sometimes it's some medical reasons that the parents give. So I try to educate them to let them know that these are necessary. So they may want to talk to their physician about that.
Because that, I think, is an important thing, because there are parents I know that are not vaccinating their kids, and it is important to know that not all pediatricians are going to sign off on that form. You need to make sure you have a good discussion with your pediatrician.
Absolutely.
One of the issues that happened this year that I kind of want to bring up, and it really wasn't kindergarten, but it was more the elementary school age. At several schools we've had a meningitis, and this is something that has all of a sudden kind of reared its ugly head, something we haven't heard a lot about in years, but all of a sudden recently we've heard more about. Tell me a little bit about that, and tell me what some of the signs that parents can be aware of so they're paying attention to these things.
Well, first of all, there are 2 kinds of meningitis mainly. There's viral meningitis and bacterial meningitis. Generally, bacterial meningitis is much more dangerous and can be deadly. Kids still get sick with viral meningitis, but typically there's fever involved. Oftentimes they have severe headache, vomiting, and it's important that they have neck stiffness too. Not neck pain, but if they cannot move their head down to look at their toes very easily and it's stiff, then that can be a sign of meningitis.
Okay.
Now, the bacterial meningitis, one of the main causes of it is called strep pneumonia. It's a bacteria. It's not the same strep that causes strep throat, but children are vaccinated against that bacteria when they're infants, and that's another reason importance to get vaccinated.
Okay.
One of the other causes of meningitis, which is different bacteria, children don't get vaccinated until later on, until they're 11, because it's more common in teenage years or college years.
Exactly.
They're looking into pushing that to an earlier age. Viral meningitis, there's no treatment for it. It goes away on its own and generally doesn't have any long-term effects.
I think that's important because a lot of parents are very concerned about this. This has just come up very recently. Now, I want to just a few last seconds here, but I want to get you one more time. You talked a little bit about the social issues, and I want to bring this up. Describe to me how parents can kind of start to begin to think about these issues. You mentioned social, is my kid ready? How do you address that with your patients, and what kind of things they need to be looking for?
Well, that's why I think it's important that the child has some interaction with other children. That's a great way to know if they can play well with other children, if they're interactive. Language skills is important too. If their language skills are not very well developed, likely their socialization skills are not going to be well developed also. So that's why I think it's important for them to have them in some kind of preschool or maybe a Mother's Day out setting so they can see their interaction with other children and to get a better gauge on that.
And this is something that a lot of parents are dealing with, especially ones that weren't sending their kids to preschool.
Absolutely.
Okay. We'll be right back after these messages. We're going to take a turn from kindergarten and look at the middle school years. We'll be right back after these messages.